In Germany, every day 30 people come down with leukemia, which is cancer of the blood. In many cases, a stem cell transplantation is the only thing that can help the patient. Finding a match for certain tissue characteristics in the donor and the patient is the key to successful transplantation. There are several million people on Earth, but sometimes only a few or even a single person whose cells might be a match for the patient. If no suitable donor can be found, that often means the patient has no chance of survival. There are two general ways to obtain stem cells: peripheral blood stem cell transplantation via apheresis and bone marrow donation. These procedures can only be performed in certified stem cell centers. We are one of these specialized facilities and have been working with lots of donor registries for years. And today, you are here because you may be a possible donor for a patient with an otherwise incurable disease of the blood. One way to harvest stem cells is taking peripheral stem cells directly through the bloodstream. This is called apheresis. In most cases, this is the kind of donation people choose. But to make sure that there are enough stem cells in the blood, donors have to have subcutaneous injections every day for 4 days before harvesting. The process is called stem cell mobilization, or priming. You are given the medicine filgrastim or Neupogen, with a hormone-like active ingredient that the body produces naturally whenever it has a common infection. Neupogen is injected directly into the subcutaneous tissue, like insulin or an antithrombotic medication. This stimulates the production of stem cells, so more can be collected from the blood. Are there side effects?
Most donors during this phase feel flu-like symptoms. These symptoms can vary greatly in their intensity, and every donor perceives them differently. As a rule, donors can expect fatigue, headaches, or joint pains, especially in the pelvic bone. We will give you paracetamol, and up to 4 times a day you can take 1 to 2 tablets. If this painkiller is not strong enough, our phone hotline for donors is available around the clock.
During apheresis, the donor rests comfortably on a special chair. One of your arms is secured, and a disposable tube leads the blood from that arm directly into a machine with a centrifuge. A cell separator here gathers the stem cells from the blood. The rest of the blood is fed back into the other arm, which is not restricted. To keep the blood from clotting in the tubes, the machine adds a citrate solution. Will I feel anything?
We add a citrate solution that may cause a temporary calcium deficiency in the donor's blood. This can lead to tingling in the mouth as well as in the fingers or toes. If the donor feels these side effects, an additional dose of calcium is quickly added to the infusion solution to correct it.
The harvested cells are fed into a bag, and the donor can see the fluid being collected, which looks like blood. Apheresis collects about the same amount of fluid that is taken during blood donation. Unlike regular blood donation, however, apheresis only takes certain components of the blood. For technical reasons, not only are stem cells harvested, but so are some platelets. As a result, after the donation, you may have up to half the number of platelets you usually have in your blood.
Blood platelets help the blood clot. Your body will make up for the temporary deficit within 2 to 3 weeks. In terms of everyday life, though, there will still be enough platelets in the blood so you won't notice the deficiency. 4 weeks later, we will have you do a lab test at your family doctor's office, and as a rule, by then, all of the values will be back to normal.
Apheresis lasts between 3 and up to 5 hours. During this period, you can watch movies from our media library or just listen to music. After a normal breakfast without too many liquids, most people can easily manage this period without an interruption. But the staff on site will always let you take a toilet break when needed. In rare cases, not enough stem cells can be collected, which means that another apheresis will take place the next day. The cells that are gathered will be tested so the donor can be informed right away if this is the case. How will I feel after apheresis?
Directly after apheresis, most donors feel somewhat fatigued, but usually this goes away after resting for 2 to 3 hours.
If a patient has certain conditions, or if the donor has medical or personal reasons which make peripheral stem cell donation inadvisable, the preferred method is surgical bone marrow donation. Here, the donor undergoes an operation of some 30 to 50 minutes under general anesthesia, and a blend of bone marrow and blood is harvested from the back of the pelvis. But isn't that dangerous?
When you donate bone marrow, and this is an important point, we don't do surgery on your spine or even take out spinal fluid, as some people think. Instead, bone marrow is collected only from the pelvic bones, from the back where you can most clearly feel your hip bones with your hands.
The doctors insert a needle at that site on the right and left, extracting bone marrow from the pelvis via the blood. The stem cells there are drawn up into the syringe with the blood. Depending on how much the recipient weighs, the equivalent of 1 to 3 blood donations is taken.
The operation lasts for some 50 minutes, and when it is over, the donor is bandaged and spends about 2 hours lying on little sandbags to prevent bleeding. On the first morning after the operation, the bandage is removed, and in the course of the morning, the donor can leave the hospital. Typically, in the first few days after the operation, you may feel mild to moderate complaints around the sites where the cells were harvested. They can feel like sore muscles or a bruise. A comprehensive conversation about the necessary general anesthesia and the related risks is held with the donor in advance.
Depending on the quantity taken, your body will recover completely between 3 and 6 weeks after donation. Before any stem cell donation can take place, a thorough medical exam is held to rule out any health risks to the donor. During this process today, we will take all of the time you need for any personal discussion and questions you may have. Beyond that, today we will also take blood and test the most important lab values and infection parameters, and do a physical examination, as well as an ultrasound of your entire abdomen. We will do an EKG and explain stem cell mobilization and the harvesting process for removing stem cells to each donor individually. As needed, we will also perform additional tests and the informed consent discussion about anesthesia at our clinic today. Throughout the duration of your stay with us, food and drink are provided. Once today's exams are complete, we will send you the confirmation letter within a week. It includes all of the results of your medical tests, as well as information about scheduling and the other things you need to know to make your donation and the priming process as smooth as possible. The decision whether or not to donate stem cells can be difficult for everyone involved. There can be a variety of reasons why someone might decide against donating. No matter what you choose, we will respect your decision. A survey has shown, however, that the vast majority of people who have donated stem cells would do it again. Thank you for your willingness to give.